Do you suffer from numbness or tingling in your hands or feet? Peripheral neuropathy is a condition that is a result of damage to nerves outside the brain and spinal cord. The good news is this condition can be treated using regenerative medicine. Dr. Shane Kokoska spoke to us about a brand new revolutionary treatment for peripheral neuropathy that is showing great success.
Peripheral neuropathy is a condition or problem of the nervous system that is outside of the brain and spinal cord. So when we have problems with these nerves, we have different sensations that show up and we have different functional losses. Nerves are funny things in that they sense the world around us. They sense hot, cold, sharp, dull. They tell us what's happening, but they also communicate to the rest of our body to tell us what to do. And when we have problems in this area, we can have different symptoms that show up. These symptoms can range anywhere from burning, tingling, numbness, itching. Usually we get an aching sensation that radiates from one area of our body to the other, such as from our neck down our arm or from our back down our leg.
My hands were painful at night. They would wake me up, and I was getting little to no sleep. They didn't just fall asleep when I was sleeping. It was driving, writing. I'm right-handed, and it was horrible. It affected everything I did. I shoot pool, I bowl, and it was causing grief to even do that stuff.
There's a wide range of causes with peripheral neuropathy. One of those causes is called idiopathic. It just means we just don't know, which is okay because we don't have to know in order to treat it. But usually our symptoms come from, sometimes it's diabetes, sometimes it's toxicity, such as exposure to something in our environment. Sometimes it's medication induced. Sometimes it can also be from alcohol abuse. These chemicals, these symptoms, these outside forces can come in and affect our body in different ways. And they can hurt these nerves. And that's our job, is to go through and bring these nerves back to health. So when we're treating anything in the human body, we have to look at the tissue it is that we're treating. Nerves are different tissue than anything else in the human body, and that tissue needs to be treated accordingly. So they do respond to care. They're a little slower, and typically we see the patients start to see good results within about 2 to 3 weeks with reduction in symptom and improvement in function, meaning they're walking better, they're feeling their sensations returning, and that altered sensations of that numbness, tingling, burning, itching we talked about earlier starts going away. RST Sanexas is new on the healthcare scene. It has recently been FDA approved for treatment of peripheral neuropathy and chronic pain, and it is very good at going in and treating. And people ask me, well, how does the treatment work? What does it do when it's in there working? And the analogy that works best is it's like you and I go to the gym and we exercise really hard to make our muscles good and strong. The RST Sanexas goes through, and its job is to make the nerves good and strong to where they function better and you can feel things properly and move properly. The amazing part about the human body is it can heal itself. It's designed to do so. It has that intelligence built in. So the nervous system isn't any different. It can heal itself as well. With any condition in the body, you have to bring it back into balance so that it can heal itself and be healed. And that's what we do with RST Sanexas. We bring the nervous system back into balance so that it can get back to functioning the way that it needs to.
I mean, it's great now. I couldn't even bend this wrist, and now I have full motion in both my wrists, and it's made a big difference, and I don't have to have surgery.
Here at HR Pain Management, we have a multidisciplinary facility. What that means is that we have a lot of different types of doctors and treating providers in the same building at the same time. That helps us in many different ways. That helps us to get more than one brain thinking about one patient or one condition, because one doctor may miss something where the other doctor catches it. And that equals safety to patients, but it also means better outcomes. We have a lot of different disciplines in the same building. What that means is we have a lot of different avenues that we can use to help treat any patient at any time, like a buffet of treatments that patients can choose what they would like to do. That allows us to help patients get better faster using different types of treatments. And those treatments include anything from chiropractic, acupuncture, massage therapy, to physical therapy, to regenerative medicine, to neuropathy. And regenerative medicine is one of our biggest up and coming areas in the clinic, along with neuropathy. Regenerative medicine focuses on getting the body to regenerate itself. We focus mainly on the musculoskeletal system. So we focus on shoulders and knees and elbows and toes, and if it's a joint, we work on it. There are a lot of different ways to get the body to kick into gear and regenerate like it was younger. So we focus on trying to get your body to heal its joint like you were when you were in your 20s and 30s.
It works. It's great. I mean, why wouldn't you? Why wouldn't you avoid surgery? Why wouldn't you avoid the pain of, going through all that? And I don't want to do that. And if this is going to help, then I'm going to do this. So, and I recommend anybody to try it.
In my years of practice, I've learned a few things, and one of them is that you've got to connect with your patient. And that's one of the things we focus on here. It doesn't matter what your degree is, what your diploma is that hangs on the wall. It's about connection. It's about the human aspect of getting somebody better and trying to be a true healer in your profession. So we would love to be able to help as many people as we can. That's our goal, that's our purpose, and our purpose is to help you get your life back now.
Dr. Shane Kokoska and his team of specialists at Health Restoration and HR Pain Management have created a new approach to medicine where you're able to be seen at one location for different treatments without having to drive all over town to different locations and avoid filling out new patient paperwork at each location. They've done the work to make it easier for you.